Have you hyperextended your knee? We're going to go over today what exactly happens, what gets hurt when you hyperextend your knee, and is it a cause for concern? My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So when we talk about knee hyperextension, we're going to go over how it actually happens. So when you hyperextend your knee, we're looking at two joints. So we're looking at your tibia and then your femur. What happens is the tibia goes backwards and your femur goes forward. So when that happens, you hyperextend because that leg goes back. And usually there's a couple ways that this could happen on the basketball court. One, it could be when your body goes forward. So you land and then you're going forward and all your weight goes forward and your leg goes back. So you have a displacement of your body weight going one way and your leg going the opposite way, and that causes that hyperextension. And that's what you could see when we talk about hyperextension. This is 0 degrees, we go past 0 degrees. So it's kind of like if you ever seen those people that are super flexible and they could get their knees really straight, that's that hyperextension. So when we go forward and our leg goes back, that's one of the causes for hyperextension. Another one is by contact. So let's say you go up for a rebound, you land, and there's a guy on the ground and he hits your tibia, the bone below your knee, and it pushes your leg back. So that gets into that hyperextension. So there's two ways. One, we have a non-contact injury where your body weight just goes forward and your leg goes back. Number two, it's a contact. Someone hits you, but you have to be stationary. So your leg has to be stationary, because if your leg, let's say you're on your tippy toes and someone hits you, you could kind of lift your foot up and your knee doesn't really go back because your foot's not planted, your knee just bends backwards. But if your foot's planted and someone hits you going forward and then it goes back, that's that hyperextension. It's very common. You see it in football players, running backs. They plant and someone dives right below their knees and that contact pressure forces them into hyperextension. There was a similar injury recently with the football player from the Rams where he got tackled, as you can see here in this video, and he gets hit and goes into that hyperextension. So now that we know how knee hyperextension occurs, we're going to go over what actually gets injured or what happens when you actually hyperextend your knee. So what happens when you hyperextend your knee, meaning like what really happens in the joint? So we're going to go over the possibilities and we're going to rank them from best case scenario to worst case scenario. Best case scenario when you hyperextend your knee is that you get a bone bruise. Because the tibia and the femur go back, they go into hyperextension. So imagine this is your tibia, this is your femur, they go back. We could have this kissing bone bruise phenomenon where both the bones hit each other and they have bone bruise, and that's some internal bleeding on the bone. It's little micro fractures, but don't be alarmed. It's not an actual fracture. It's just more of a bone bruise, but a bone bruise doesn't do justice. They're actually pretty painful because they're bruises of the actual bone, not like a muscular bruise. And that's your best case scenario, because with that one, there's no surgical intervention. There's no injury to the ligament. It's just a bone bruise. And we're looking at more pain tolerance as your recovery. It may take a while. There's a lot of bone bruises that take a long time to recover, but this is your best case scenario from a knee hyperextension. So the bone bruise, it's just more like it's gonna hurt, but then it's gonna slowly, pain's gonna decrease, and how much you could push it or progress it, it's all based on your pain tolerance and the pain that you're getting from the bone bruise. And normally it hurts when you have it to go into those deep squats or a lot of weight bearing or a lot of dynamic activity. The next best case scenario is just posterior capsule laxity, meaning when we hyperextend, we have a posterior capsule here that helps protect your knee joint from going into hyperextension. So when you go into hyperextension, it might stretch that capsule. So that means your knee might hyperextend a little bit more than usual because it's a little loose. So that's a good case scenario, because on this one, you're not injuring a major ligament, just the capsule is gonna be a little loose. This one, you kind of treat it conservatively, get your quad stronger to help prevent that knee hyperextension and control, and you'll be in a good position. Now, on this third case scenario, we start going into the little tricky ones, the ones that you don't want. So the first one, we're gonna break it up into ligament, meniscus, and then muscle. We'll go straight into muscle. So when you hyperextend your knee, there is a possibility for you to almost tear a piece of your tendon from your muscle, because when you hyperextend, you have your hamstring muscles that attach below your knee joint, so here in the tibia, and then you have your gastroc that goes above your tibia in that femur. So when you hyperextend, you stretch that out, you increase the risk for having a tear in your muscles. And that's going to take a little while for recovery. So that's what we don't want. But luckily, that's in the good side, because we're going to go over ones that are not so great, because that's going to be more conservative. You might not need surgery depending on the tear of the tendon or the tendon of the muscle itself. It could be the muscle belly or the tendon, because you're just stretching out the side where the tendon attaches. So you might tear that or strain it. Bad case scenario would be more of the meniscus. So when we go into knee hyperextension, we have the risk of tearing our meniscus. So when we tear our meniscus, there's several options. One, there's a non-surgical route, which majority of meniscus injuries do well with. However, there is a case scenario where you might need to have surgery. And the surgeries, there's two types: a meniscectomy, which will take you out for at least 3 months. However, long-term, it's not so great for your knee. Then you have the meniscus repair, which will take you out around that 6 to 7 months, which is better off for your knee because it repairs the meniscus. For the non-surgical conservative route, it all depends. We're looking at making sure we get the range of motion, we get our strength and stability back in our knee before we go back to sport. So that's the meniscus side. The next worst case scenario is a ligament injury, specifically ACL. So when we go into hyperextension, there might be some little twisting causing that ACL tear. So when we have that ACL injury, then that we're looking at, you're going to be out for a year if you have surgery. If you don't have surgery, if you don't have any instability, then you might be out much less. However, most of the time, most athletes get ACL surgery and they're going to be out for a year. That's almost not as bad as this last one. The next one is a fracture. So a fracture is sometimes when you go into this hyperextension, you might have a tibial plateau fracture or fracture any part of the femur or femoral condyle or the tibia, and that takes you out for a while. Although I would say the ACL is a little worse, but a fracture is going to be painful and you're not going to be putting weight on it for around 8 weeks, and then you got to restart the process. And if it's in the tibial plateau, it might take you out even longer. But the really worst case scenario is a full knee dislocation. It's not as common, but when you go into hyperextension, if you get enough force, especially in a contact injury, you might even be able to dislocate your knee. And when you dislocate your knee, we're talking about that, not your kneecap, but the actual knee joint of the tibiofemoral joint. So meaning your tibia and your femur, they separate and there's an artery there, there's a nerve. So that could lead to a whole lot of issues. One, it could be an artery issue where you might have to go to the hospital to save your leg right away because you sever that artery. That's bad news. We're not gonna have blood flow in that leg. The other one, it could be even a nerve injury. You could lose control of your foot or lose control of your muscle because you severed that nerve injury when you hyperextend that bone because it hits those nerves or arteries. So those are the possible case scenarios for a knee hyperextension. So to quickly recap them, we have the best case scenario, bone bruise into a posterior capsule laxity, a muscular injury, a meniscus injury, ACL injury, a fracture, and then a dislocation. All right, guys, I'm gonna summarize what we learned today. This is a big topic. I covered a lot of information. So when you hyperextend your knee, there's several case scenarios that happen. So when you hyperextend your knee, first of all, your knee is going to go back just to make sure we got the concept down. You hyperextend, the tibia goes back. It could be between two things. One, someone could hit you, or two, non-contact, your body weight goes forward, your leg goes back. So once that happens, there's different scenarios or different structures that could be injured in the knee. One, bone bruise. We could also have a soft tissue like a muscle. Could also be the actual capsule. It could be loose. It could be also a meniscus, a ligament, also even a full dislocation of the knee. To find out what structures you injured, first you got to get an x-ray if you can't put weight on it, can't bend your knee, or if it's very tender. Then after that, you get an MRI to rule out stuff. But either of those injuries, we would want to first manage the swelling as much as we can because the swelling is going to be really painful and it's going to affect the testing. So manage the swelling, work on some range of motion slowly, and get that MRI and x-ray. So that's kind of the main gist of what we went over. So hopefully you guys liked this video, learned a lot. If you like it, hit the like button and subscribe button and share this with friends and family. We are the Basketball Doctors. Let's ball for life.